You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Hi, thank you guys. So my name's Kelsey. I'm the program coordinator at Tower Health. I'm just going to start off by a little introduction, and then I'm going to hand it off to one of our PGY2s, Dr. Parkesh. So we're one of the newer programs. We're in West Reading, about an hour outside of Philly. We were initially accredited as an advanced program. So our first group of residents just started this July, and we have another group that's doing their prelim year elsewhere, and they'll be starting in 2022 as a PGY2. But recently we got ACGME accredited as a categorical program, so that'll be done at Reading Hospital. So Dr. Parkesh will talk more about that. So with that being said, I'm going to pass off the rest of it to Dr. Parkesh. He's going to go through some of the slides, but not hit every bullet point because we want to save time for the Q&A portion. So if anyone has any questions during the chat, during the presentation, you can put it in the chat and I can organize things for after the presentation's done.
Thanks, Kelsey.
Yeah.
And thanks, Vinny and PM&R Scholars for hosting us. Pretty excited to share all about our program. I'm going to attempt to share our screen. Vinny, can you confirm that you see our screen?
Yes, sir, we do.
Okay, great. Okay, so I'm going to pretty speed through this slideshow. Everybody will get a copy. They'll get, they can go over the details and email me or Kelsey if they have any further questions.
Right now we see, I guess, your desktop. We don't see slides.
Okay. Now do you see slides?
Not yet.
Okay.
I think we see your background, your desktop.
Okay. All right, give me 1 second here. All right. I don't know why this is not working. I'll just take 1 more minute, see if I can figure it out. Otherwise, I'll just go with it.
We can see your desktop and we can see your pointer moving, but we don't see slides.
Yeah,
so
that's
you might want to
I'll
stop
close.
sharing and share again.
Okay.
As we wait for that, I did just put my email and Dr. Parkesh's email in the chat. If there's any questions that aren't answered by the end of this presentation.
Okay. See anything, Vinny?
We don't see the slides. We still see the desktop only.
Okay.
Do you want me to try to share my screen and see if you can,
Kelsey?
Yeah, and maybe I'll just advance as we go. You'll have to stop. Okay. How's that?
There we go. Yep.
Okay, let me
Perfect.
get to the beginning. Sorry, I was,
You're ready to go.
okay. Little spoiler alerts here, but
Okay, great. Thank you. All right. Sorry for the delay, everyone. So we're Tower Health, Reading Hospital, new program. We're the inaugural class. We all started PGY2, as you know. We're going to be a categorical. So next year we'll match 4 PGY2s and 4 interns. We're also associated with Drexel School of Medicine at Tower Health, a brand new medical campus, part of Drexel. So just to talk about our rehab hospital a little bit, we're a separate hospital, 111 beds, 61 acute rehab, which includes 21 TBI rooms. We've got a pharmacy on site, aquatic therapy pool, lab, radiology services. We've got 11 physiatrists on staff with multiple subspecialties, including pain, spinal cord, TBI, etc. And we got a beautiful therapeutic garden, which is great for patients. Nice place to meet with families, especially during COVID times. And we have a dedicated hospitalist teams that help us care for the patient medically. Okay. And then we're also connected to Reading's main hospital, Tower Health Reading, which is a huge 700-bed hospital, level 1 trauma center, busiest ED in the state of Pennsylvania. So as you can imagine, we get consulted for some pretty interesting cases, whether it's trauma or neurological or MSK, etc. It's a beautiful hospital, has brand new renovations, another beautiful healing garden on the roof, the largest green roof in Pennsylvania. Okay, next slide. So obviously we're a freestanding rehab hospital. It's a great place to learn, dedicated to rehab, essentially. I talked about we're a categorical 4-year program. We have a great salary, low cost of living in Reading. We have diverse faculty and patient population, similar to the way Mount Sinai was talking about. You'll have very, very interesting cases. We had a patient with hemibilismus from newly diagnosed diabetes. I'd never seen hemibilismus like this ever in my life, in my training until now. So it's very interesting cases. One nice feature for us residents is we have no true call. We work 1 weekend a month as PGY2s and 1 holiday a year. And if you work 2 holidays in your PGY2 year, you won't be asked to work any holidays for the going forward. And that weekend shift trends downward as you move forward. And this is a little example of our schedule. So obviously I'm in PGY2 right now. I'm in my inpatient trauma and complex medicine. We play a heavy emphasis on Parkinson's patients. So I'm managing a lot of Parkinson's patients. I'll have patients with, 6, 7 different comorbidities. Very interesting and difficult to manage, but you learn a lot. And trauma, obviously your ortho cases, hip replacements, hip fractures, ankle fractures, and so on and so forth. The rest of my co-residents, they're all in inpatient rotations. Everybody starts that way: inpatient amputee, inpatient stroke, and inpatient spinal cord. All of those are accredited by CARF, which you guys will know later on what that means, except for spinal cord, which is in the process. So basically, exemplary rehab units. And then we also have a mix of 4 months of outpatient, which allows a good change of pace. You do those 2 months at a time. So those are great. And then going forward, as you can see, PGY3, you get some elective time, pain, MSK, clinic, EMG. So we're really strong in EMGs. You'll blow by all required numbers with our program. And elective in your PGY3, you can do it early because if you have any fellowship interests, some electives are pain, sports, neuro, movement disorder clinic, and much more. Quickly, just talk about our acute rehab unit. So we have 25 beds on both wings. One wing is divided up with amputations. Another wing is basically trauma, complex medicine, including Parkinson's, where I'm at now. And the other wing is stroke, spinal cord injury, and obviously some wings will get overflow from another wing depending on what the day is like. TBI is a secured unit upstairs. Very, very interesting cases because we do have a lot of trauma, motor vehicle accidents, which lead to TBI. Our average daily census, we're almost full pretty much all the time. And we have some great devices that we work with, exoskeleton, zero gravity gate, machine that allows patients, we can control their weight bearing. In driving simulators, we can help patients assess their driving. Next slide. Go next slide. Okay, thanks. TSU, so that's our upstairs wing. That's ran by the Hospitalist team, and we will be consults there. So that allows us to play a consult role in-house, and then we'll also do consults at the main Reading Hospital as well. So it's very, 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 very variety of responsibilities for the resident. Okay, outpatient clinic. Here you can see us working on ultrasound. Yeah, as I said, you'll blow by any EMG requirement. We're doing EMGs all the time, Botox all the time, EMG guided Botox injections. We have a robust cancer rehab program. The spine clinic shows 650 patients a year. And then we have multidisciplinary clinics where we have specific amputee days, Parkinson's days, wheelchairs, and dealing with baclofen pumps. A lot of our physiatrists are trained in baclofen pumps. And then just talk about our PEDS rotation. That's at a separate facility, Good Shepherd Pediatric Rehab. It's a 20-bed dedicated inpatient PEDS unit treating up to age 21. That we'll do later on in our training, but it's great, a great experience. We have a specific doctor, Dr. Yu. He's specially trained in pediatric Botox for cerebral palsy. So he's a great person to learn from because obviously the strategy with kids is a little bit different. So now just talking about our brand new Drexel University College of Medicine at Tower Health. So we get med students all the time from Drexel as it is, but now they'll be located, the M1s and M2s will also be local, and we'll be able to teach with them, work in their anatomy lab, and provide, early skills dedicated towards PM&R. PGY, I'm not the best to talk to this because I did my transitional year somewhere else, but our transitional year here, which will be our PGY year, essentially is a great experience. You got three blocks of medicine, one ICU, one ED, and again, ACGME only allows you to do 1 true month of PM&R, but you can also get some sports experience, pain experience, which is very fruitful if you already know you're going to be here for PM&R, essentially. Yeah, so this is just a little bit more about the call schedule. You guys can see that in the slide. It's not too much. It's all self-explanatory. Didactics are great. We do it every Wednesday, protective. You turn off your pager. You don't have to worry about a thing except for studying. So we have great amount of different speakers coming from inside and outside the facility. And we learn about, speech therapy, PT, OT, they all come in, give great lectures. The hospitalists do, as obviously our general PM&R lectures. We do ultrasound, hands-on lectures. We're working, examining each other. So our instructors like to keep us involved. It's not your mainstay boring slideshows. So that's something great. Just talking about Reading a little bit. West Reading is a great area, very walkable little town. Cost of living is low. I live in a 2-bedroom, very nice apartment for under $1,600. Your salary is great to allow you to save some money, pay off some debts, et cetera, et cetera. Some of our unique resident experiences. So we're going to start working with the street medicine clinic with the IM team. So that will allow us to, pay it forward to those less fortunate than us. I Am Able is Adaptive Clinic. It's another clinic where we work with the disabled. USA para fencing team again, Paralympics with the fencing team. Reading Royals, that should be something very exciting. We're working with the local pro hockey team. They're basically couple levels below the NHL, but a lot of their players transition to the NHL. So we'll be doing sideline work with them. So that's very exciting. They have a nice arena locally. And then other things like Fitbit team challenges throughout the hospital, who can do the most steps, doing the trails around the town, etc.
You have 5 minutes left.
Okay. So just quickly, scholarly activity, that's me presenting at a pain conference. You can go next, Kelsey. And the rest is pretty self-explanatory. Now we can just go straight to questions. So we're open to anybody who's, qualified. Basically, we're going to look at your application holistically and see, how great of a candidate you are and what a great fit would you be like. So the program is changed to categorical. So it's full categorical starting this match. Life in West Reading is nice. It's a great walkable city, a lot of breweries, a lot of restaurants. The hospital's close by, so a lot of residents. So we have a bunch of residencies, bunch of fellowships. So a lot of people you can hang out with.
And to
Yeah.
talk about the question about IMGs, we also take J1 and H1Bs for those who are looking beyond. I think there was someone from Canada, so I'm not sure if that would apply to you. But we do J1s and H1Bs.
And yes, you'll have access to these slides after this, definitely, and you can email us. Can you give examples in clinical work? Obviously, doing a PM&R rotation, scholarly activity in PM&R, AAP or AAPM&R, those are great. New program, very open to feedback. Pretty much every few weeks, they're asking us what they should do different, what we like. We pretty much are molding this program, and it's a very unique experience.
One of the residents said, "I've never saw a program coordinator see like around so much, because I'm always asking you guys like, how's it going? What do you need? What's going on? What can we change? What can we do?"
Exactly. The program coordinator and director, they're always ready to hear our input. Research support is great. I already presented a case report. I plan on working with the med students to present at AAP in February. We're working on different case reports, and if we find anything, very interesting, we will pursue it further. The IRB chair is actually one of our hospitalists, so we have direct access to if you want to conduct any prospective study or et cetera, et cetera.
You have 2 minutes left.
And going back to life in West Reading, you get kind of like the best of both worlds, because you're so close. It has like downtown shops and everything, but we're so close to the outdoors. So if you like hiking, biking, outdoors like that, it's within 5 minutes of all outdoors, all nature, skiing, things like that. We're also very close to Philadelphia, big cities, and a train, so it can take you to those big cities very quickly.
Early exposure, again, during your transitional year, you're able to do pain elective, sports elective, and then we're doing ultrasound, MSK pretty much all the time, even inpatient complex medicine. If a patient's having pain, our program director is the injection whiz, and the ultrasound whiz. So me and him will always team up and do ultrasound guided injections. We've already started our curriculum 1 month in, because he knows how enthusiastic we are procedure-wise. So, and then I'm already in discussions with the pain management group about how to move forward, because that's the fellowship I want to pursue. Yeah, you all have one dedicated mentor. So right now we have 11 physiatrists to 4 residents. As we add more residents, I think it's going to keep adding. Um, we just developed a strategic alliance with Penn as well, which Kelsey will probably talk more about if we have the time. But I think Vinny's coming here to let us know it's time.
Very good. That was a good cue. You had about 5 seconds left.
Okay.
Thank
Well,
you so much for your
thank you,
presentation.
Vinny. Everybody can email us if they need to. Thank you.
Yeah,
Th-
thank you.